dead people. I mean, are you serious?
Inappropriate radiotherapy was the most shocking for me, because here was an instance of pure greed, and clearly the patient was being very disadvantaged.
The patient walks through the door and it's, how much can I get? You know, ka-ching, ka-ching, ka-ching.
I think they see Medicare as a money pit and they can just help themselves.
Medicare costs us almost $30 billion a year. But we've discovered the system is being rorted by health professionals, fabricating medical records and billing unnecessary services to boost their profits. Tonight, we'll show you how an estimated $8 billion is leaking out of a system we all rely on. The lack of regulation is staggering, and patients' lives are at risk. I'm on my way to meet a GP who wants to blow the whistle on his own profession. For years, he's been carefully gathering evidence.
You have one new message.
Hi Adele, it's Austin here. I've got all the emails, the CCTV and the documents all ready to go for when you get here. Look forward to seeing you soon.
Why did you decide to speak up today?
It just seems to be the right time, an opportunity for me to tell the truth.
Dr. Austin Stern worked at one of Australia's biggest super clinics, Tweed Health for Everyone. He was also a founding partner. What sort of things did you find?
There was falsifying of patient records, there was billing Medicare for services that hadn't been provided, and there was over-servicing going on as well. One particular practitioner in the clinic was diagnosing patients with diabetes when they hadn't got diabetes. They may have pre-diabetes, but that's not diabetes, because if a patient's diagnosed with diabetes, there's an additional Medicare item number and a fee that's payable for each patient that you've got who's got type 2 diabetes.
Medicare is a complex system. It was built on an honour system that medical professionals bill correctly. Each year, $28 billion of taxpayer money goes into a fund that medical professionals can claim using an item number. There's 5,800 item numbers for things like GP visits, surgeries, pathology tests, and X-rays. But the problem is most of us never see what services our health professionals may have claimed.
The system, Medicare is based on, it's on a trust where we're entrusted to do the right thing by the taxpayers and by the Commonwealth for the health of people. And then suddenly I found myself in an organisation where that's not the case. It's about money and it's about power.
Dr. Stern joined the super clinic in 2013. 2 years later, he found a patient had been billed by the clinic twice on the same day.
Once in the morning and once in the afternoon. That's very unusual.
Could it have been a mistake?
No. And the fact that later on this was happening with multiple patients over multiple days, that was not a mistake that had happened.
The more he looked, the more he found. Alarmingly, he says some of the activities were putting patients' lives at risk.
There was one patient, in fact 2 consecutive patients, where one practitioner had copied the examination and just simply pasted it into the next patient, so their weight and their BMI was exactly the same and their diet was the same as the previous one.
Could that be dangerous?
Yes, absolutely. In the event that somebody becomes unwell and they haven't been given the right advice, that they may end up in hospital, they may end up passing away.
Dr. Stern told some board members in 2015 about his concerns.
At first they didn't want to hear. I was trying to arrange meetings and they didn't want to meet.
He says on another occasion, he warned the super clinic it was wrongly claiming hundreds of thousands of dollars from a procedure called wound debridements. He was concerned the claiming for that procedure didn't meet the requirements for Medicare billing. On what basis did they decide to keep doing it?
It was absolutely money. It hit $400,000 a year, or $400,000 to $500,000 a year through wound debridements for the clinic.
Over more than 2 years, Dr. Stern meticulously gathered evidence, including CCTV footage, appointment books, and the billings.
This is the rainforest waiting room, so you could see what time they came in and what time they left the room, and on the date that it was done.
And you'd marry that up?
Yeah, so we married it up with the appointment book, and then the billings didn't reflect the people who were going in there, and the billings didn't reflect how long patients were spending in that room either.
But this is pretty damning, it's completely empty.
Yes. There was another day where she didn't see any, and she was sat in the back office just billing patients.
It's not just one clinic rorting the system. Dr. Margaret Foe has spent much of her career studying Medicare, and she believes it's broken. So this is the PhD?
Yes, and it took me 8 years.
I'm meeting her to find out just how bad it is. She gets paid by doctors, hospitals and corporate medical practices to process their Medicare bills. Now she's speaking out about the waste she sees every day. So what are we seeing here?
So this is our billing software, which is online to Medicare. And I've put myself in here as a patient. So you can see how little information you need. You just need first name, last name, date of birth. You need a Medicare card, but if you can't get it, it's quite easy to get Medicare numbers if you're authorised. And these are bulk bill claims. They're all going to Medicare. They've all been successful. So what that means is the money will be in the bank account of the doctor overnight, no questions asked.
As easy as that?
Oh yeah.
Dr. Foe estimates $8 billion is lost each year to the Medicare budget due to fraud, error and over-servicing. That's almost 30% of Medicare's total funding.
The bottom line is we don't know exactly how much is fraud, deliberate abuse, and how much is errors. But in the end, it actually doesn't matter anymore. Whether it's deliberate or unintentional, it has to stop. Medicare is not free. We all pay for Medicare through our taxes. And what we're seeing at the moment is signs of system failure everywhere. We're seeing ambulances ramping, public hospitals can't cope, general practice is in tatters. It's all part of the same problem. So it is taxpayers who are paying for a system that they can no longer afford or access.
The problem isn't a new one. When you queried some of the doctors for things that inappropriate spending, what sort of reaction did you get?
Some people put up their hands and said, yes, I'm guilty. Some people tried to defend their actions, and some people said, well, everyone else is doing it, why shouldn't I do it? There are many ways to rort.
Dr. Tony Webber has intimate knowledge of the waste because he used to run the Medicare regulator, known as the Professional Services Review. In 2012, he estimates $3 billion a year was leaking from the scheme through fraud and waste. Dr. Margaret Foe estimates there's about $8 billion a year in leakage now.
And that I would not be surprised at that. I've read her PhD, and I'd have to say I agree with what she said.
The Department of Health and Aged Care said in a statement it has a strong compliance program to ensure the integrity of Medicare.
If you look at it over the life of Medicare, we've probably lost at least $150 billion. So if you think about that, like think of what we could have done with that money. We could have built, more than a couple of hundred state-of-the-art hospitals and given the whole of Australia free dental services for that.
It's coming from most sectors: doctors, pathology, radiology, surgeons, anaesthetists.
I think most Australians believe that doctors are honest people, and I'd like to think that most of them are. The truth is, anywhere where you've got a huge pot of money that is super easy to access, you are going to get bad actors in there building business models, just taking the money unlawfully. And it's a huge problem in the Medicare system, always has been.
One of the country's biggest virtual GP super clinics is Phoenix Health. Patients of Phoenix have come forward to show us their Medicare records. Leaked documents show instances in which the telehealth company charged patients for a consultation, but also bulk billed them, which is illegal. One of the companies that was processing their medical bills until recently is run by Dr. Margaret Foe. We've been informed that the bulk billing claims were generated through your software. Can you comment?
I wasn't expecting that. Phoenix was a client of Synapse, but is not anymore. When I became aware that that was happening, I had no option other than to terminate our contract with them and disconnect them from our system, which is what I did.
Do you know how many claims they processed?
Through our system, there were more than 30,000 patients. What Phoenix was doing is illegal. It's very common. It's very, very common.
Phoenix said in a statement, it is aware of the complex rules surrounding Medicare billing, and it strives to ensure its billing practices comply with those rules. Dr. Austin Stern says he witnessed a culture of doctors putting profits before patients.
It was probably the worst 5 years of my life, the time that I was in the clinic. It was awful.
At different periods, he says he sought legal advice to try and change the super clinic's behaviour.
We got legal advice from 4 different sets of lawyers who said, you've got to report it to Medicare, refund all your billings. Trying to get the practice to do that was an enormous job. It was very stressful and eventually led to myself being removed from the practice for trying to protect the Commonwealth's investment and for trying to prevent Medicare fraud in the business.
In 2017, he took legal action after the board tried to get rid of him from the company. In December, they reached a financial settlement and he left. One of the practitioners resigned and Medicare was informed that some billings were claimed incorrectly. Senior management and the board have changed since Dr. Stern left in 2017. A spokesman for Tweed Health told 7:30, the super clinic takes compliance extremely seriously and conducts regular training for doctors. Do you think in retrospect was it worth speaking up?
Yeah, because I couldn't work in a clinic where it's okay to do that.
The cases we've uncovered aren't isolated. Some health professionals are blatantly cashing in on Medicare. In February this year, a GP was caught by the regulator billing dead people and had to pay back almost $300,000.
Billing dead people? I mean, are you serious? I mean, how low can you go?
Another shocking case from June this year. A dentist was caught exposing children to unnecessary radiation to claim extra benefits under the Child Dental Benefit Scheme. The dentist had to repay $650,000 and was offered counselling.
Counselling? That's it. I don't know how you can do that to anyone, let alone kids. Like exposing children to radiation, that's unconscionable.
It seems that rorting Medicare is so easy, businesses have sprung up to teach doctors how to get the most out of the Medicare codes, known as item numbers. Billions of dollars are at stake. We obtained access to the teaching materials from one course that was teaching doctors how to milk Medicare. It's blatant.
In our clinic, we do have a target, not a specific target, but we do try to, when a patient leaves the clinic, we try and get them to specifically make a plan to come back.
So stacking is also utilising care plans, health assessments, multidisciplinary case conference, medication reviews and nurse reviews where appropriate, again, to maximise rebates.
I don't need to see anymore. I just find that utterly depressing, egregious. And the other thing that this commentator clearly says is this is not about gaming the system. It's not about rorting the system. It is absolutely about that. It is about nothing else. It is about gaming the system and getting as much out of it, milking Medicare to get as much out of it as you can. That is what this is about.
Doctors are finally speaking out after years of being ignored. They've seen firsthand our health system put under increased pressure and patients put at risk.
The whole system is leaky and needs a complete revamp. It's going to get worse, I think. I think people will be more disadvantaged.
The public see doctors as probably altruistic and doing the right thing, and it's just disappointing seeing that isn't the case. I'm disappointed in how some GPs behave.
Out-of-pocket costs are just going to continue to soar and patients won't be able to access the care that they need. Medicare doesn't have a lot of life in it, unfortunately. I'd give it a couple of years, max.